Hello, and welcome to Ben Yo Chats. If you're curious about the world, this show is for you. How should we think about risk in the world? On this episode, I speak to David Spiegelhalter. David is a statistician and former president of the Royal Statistical Society. We speak on COVID statistics, alcohol risk, and how we should think and communicate about risk. I also learn about the Rose paradox and Cromwell's law. If you enjoy the show, please like and subscribe as it helps others find the podcast. Thank you. Be well. Hey everyone, I'm super excited to speak to David Spiegelhalter. David has a new book out, COVID by Numbers, which is an excellent book on COVID statistics. This follows his previous bestseller, The Art of Statistics. David is an expert on medical statistics, was the president of the Royal Statistical Society, and is chair of the Winton Centre for Risk and Evidence Communication. He is also a world champion in a version of pool called Loop and hosts his own podcast, Risky Talk. David, welcome.
Oh, wow. I'm very pleased to be here and great to get all those good plugs.
Thank you. So when writing your book, COVID by Numbers, what did you find as perhaps the most surprising or most misunderstood of the numbers that you found? For me, in the UK at least, I think it was the data on what people perhaps would call the social determinants of health. So this was some of the data you had on professions such as chefs and bus drivers, which had, I think it came out as age standardized mortality around 80 to 85 per 100,000 compared to an average closer to 30 to 35. And as I discussed actually on an earlier podcast with Megan Cole, an epidemiologist, the data kind of around poverty and deprivation and how that was affecting the numbers, that kind of actually surprised me. But I don't know what perhaps surprised you most or what you thought was most intriguing coming out of the book.
Okay, that's good. Now, first of all, I should say I'm only a co-author with Anthony Masters, who we've been working together for a year now, writing a weekly article in The Observer, which has been an interesting discipline. We've done about 50 of them now. We're about to stop, which will be a great relief. Yeah, we get on very well because we're both statisticians. We tend to agree with each other very much about the stats and about what we find interesting and surprising. We disagree sometimes about writing style. I am slightly more journalistic and he's more formal, but never mind. We managed to sort that out. But in terms of surprising stuff, yeah, we make quite a thing, about the surprising stuff. Okay, we'll come on to the determinants in a minute. But I remember one of the ones perhaps I shouldn't have been so surprised about was the fact that the pandemic has been a net lifesaver for young people. That in 2020, 300 fewer 15 to 30-year-olds died in England and Wales than we would have expected, and 100 died from COVID. That means 400 fewer non-COVID deaths over the year. And, if you think about it, you think, well, yeah, people were young people were locked up. They weren't driving and having accidents. They weren't going out getting drunk and getting into trouble. And so far fewer of them died. But the interesting thing is the asymmetry, because there's 100 families over that year that were mourning the death of a young person from COVID, terribly tragic events. But there were 300 families who were not mourning the death of a young person, but because they don't know who they are. And it's this asymmetry between lives saved, which are statistical lives and nobody knows who they are, and lives lost, which are identifiable lives. And that means they have a very different emotional impact on people. And that comes into all sorts of things like, new forms of motorways and so on. So, okay, that was interesting. The surprise, no, the ones that get misunderstood, I think you said the ones that get misunderstood. Yeah, I think it's the usual stuff about just the daily data that gets reported. And it's great that we get data. I'm clicking on the dashboard at 4 o'clock to see what happened, like hundreds of thousands of others. And it's great we get that daily data, but it's not the best data because it comes incredibly rapidly. Where it's only about what's been reported. And so cases, we shouldn't look at by the number reported each day. We should look at at the numbers by specimen. If we're going to get an idea of what's going on, we should look at when the sample was actually taken. And even then, we have to go back a few days to know when people were infected. So, just yesterday, we're recording this at a time when, there was 90,000 cases reported yesterday. Well, in fact, if you look back at the data a few days ago, last Wednesday, there were more than 100,000 positive specimens were taken. There was a huge threshold passed that the media completely missed because they're only looking at this daily data that gets reported. And then, of course, the number of deaths. Well, this is the number of deaths of people within 28 days of a positive COVID test. Of course, they might not have died of COVID. COVID might be incidental. All sorts of reasons. People might die of COVID after 28 days if they've been in intensive care or whatever. So it's not a great number. It's not a bad number. It's sort of useful, but we have to really wait a couple of weeks for the death certificate data from the Office for National Statistics. But worst of all about that 28-day number is it varies hugely depending on the day of the week. In the book, we illustrate that if you just look on Sundays, it's about half the number of cases reported than on Wednesdays. So, it's just ridiculous. And the Evening Standard has been appalling. 3 times they've had a headline, cases soar, because of a change from Monday to Tuesday. That's the biggest jump usually. Cases soar. And oh Christ, you're just hopeless, This is after a year and a half. Don't you know this, that this is not the number of people who died yesterday? The deaths can go back, long way, days and days, possibly even weeks. And so this is it just drives me mental. And it's often, the health reporters are great. We can come on maybe to reporting later, but it's when it gets in the hands of the general reporters that they are completely hopeless often. Okay, the social determinants is fascinating, and in the book we cover occupation to some extent, because there's a big interest in. You mentioned about coach drivers, very well known, security guards, chefs, public-facing roles, people working closely in teams. Have been at much higher risk. It's well established. But also the interesting thing is the other factors that we know have been at risk, which is to do with deprivation, living in multiple occupancy housing, certain occupations, and ethnicity. Now, the real problem is all those are hugely correlated. Trying to separate out, and of course medical conditions and obesity. They're all sort of utterly tied up with each other. And so the Office for National Statistics and others have made a real effort to try to disentangle those using statistical methods where you kind of try to keep one thing fixed and then see what happens when when the other one varies. Those statistical regression methods are always inadequate. They never work quite, but they are helpful because it does make you realize that almost all the effect of ethnicity was explained by, if you allow for occupation, medical conditions and deprivation and multiple occupancy and so on, then almost all the effect of ethnicity is explained, not quite all of it. Unfortunately, there's no database that could put occupation in with that as well. So I don't think anyone's ever been able to look at all of those things together to try to tease them out. Very difficult to do. Of course, with vaccines, there's a big ethnicity effect happening at the moment because there's a big difference in the take-up of vaccines by ethnicity. So again, just saying, oh, well, certain communities have got higher death rates is actually not very helpful because it sort of suggests somehow there's some genetic effect, and I don't think there's any evidence for that. Need to try to drill down and work out just why. And that's what statistics is about, trying to work out, kind of give a suggestion of why without ever, well, all the time being unbelievably cautious about saying why. We don't do causality very much at all. We don't like it.
Yeah, I mean, those confounding effects, like you say, deprivation, and then even just sort of the country differences, like you were alluding to, countries define death very differently. So often not an apples to apples comparison and all of these other confounders. I recommend your Twitter feed as well. And one element I picked up from that is how numbers and statistics are essentially often emotional, and how a lot of parties have essentially weaponized them in some way, either sort of defensively or offensively, where you're using seemingly big numbers and big letters used to make a point. And we come across this idea that numbers are kind of neutral, but actually when humans use numbers, they're not neutral at all. And
Yeah.
although the data might be true, there's a lot of emotional value and can be very manipulative. I do think this is a particular problem today, or we're more acutely aware about it. And what perhaps should we do about it to defend ourselves from these emotional numbers, to get a kind of maybe clearer sense about what might be more true or not true?
This is such an interesting area. I think that everyone with the COVID in particular has become very aware of indeed. I grew up as a mathematician and then a statistician, and I kind of thought that numbers were cold, hard facts, statements around the world, and they were sort of sacrosanct things. I'm afraid I've had to completely change my view on this, both through a number of really good exposures. First is by trying to do communication, and you realize once you're in the media world, which I have been doing, how storytelling, emotional impact is so valuable, and how I use it all the time. You know, I use humor, I use storytelling, I use my own, self all the time to illustrate what I feel is important about statistics. And secondly, the fact that my work now involves work with psychologists and so on, and social scientists who have taught me so much about this. So I always go back, like in my book, Art of Statistics, plug, which thank you very much. I kind of start with this quote from Nate Silver, excellent writer of Signal and the Noise. He says, the numbers do not speak for themselves. We imbue them with meaning. And I think that's such an important point, because it really says what it says. The numbers don't speak for themselves. They don't give up their knowledge and their lessons automatically. There's no algorithm that will tell you what to learn from data. We have to, this is always mediated by human influence. And so often that mediation involves, in a way, the exploitation of those numbers to make an argument. I feel I've got this, after years of practice, I can make any number look big or small. I could make any number look frightening or reassuring. Just tell me what you want it, what you want the impression to be. And of course, these are, I've many people with these skills, and it's extremely dangerous because it means that the numbers being used. Well, I think I invented the term number theatre last May, which was an accusation at the way the numbers were being used in the government press briefings. Lots of big numbers being thrown out, regardless of their validity or their meaning or their context. And I thought, this is pure performance art. You're pulling a number out of thin air. And I actually accused the health secretary of that last week when he pulled out this number about 200,000 Omicron infections. Today, to announce to Parliament, well, it's a nice big number. It could very well be true. We don't know, and he didn't give any justification for it. And the methods weren't published for days, till days afterwards. So I think that's really not acceptable way to communicate numbers to the public. And so many people have picked up on this. Tim Harford, I'm a huge admirer of him. His latest book, starts with questions to ask about numbers, which is, we're always asked this. And his first one is, how does the number make you feel? The very first question, before you ask whether you believe it or how does it make you feel? And I thought that's such an interesting thing. And actually, that's also Full Fact, Will Moyes, fact-checking organization. They also have got a little 3-point check about numbers, and they are saying, how does it make you feel? So in other words, by looking at your own feelings and your emotional responses, you can start understanding what the provider of that number is in fact trying to induce in their audience. What are they trying to do? They're like a writer in theatre. They're trying to produce an emotional impact, usually either fear or reassurance. And so we have to identify when that's being done. And you do that by looking at context, by, is this really a big number, about trends and so on, and about trying to communicate those numbers in a balanced way. Now, I love numbers. They're so powerful and they're so useful, and I want them all the time. But I know that they've got to be interpreted with great care and great caution. So when someone is using a number as a rhetorical device to bash me over the head with it, to change my feelings about something, I'm deeply suspicious of that, deeply suspicious. And I think that needs to be countered, but it's very difficult to do. If you can quote some number with lots of zeros on it, everyone says, whoa, that's important. Well, maybe it isn't. So I think it's a continuing problem. I'm sure it's always existed in the past, but I think now with social media, and particularly with the pandemic, where there's so many numbers around, that it's become extremely apparent, extremely sort of important. And to me, it's just completely revitalized my interest in statistics, because it's turned from what used to be a sort of technical mathematical interest to much more their social role. Because, people have been talking about this for ages, and I never want to suggest somehow a real relativist position that, oh, well, there's no such thing as truth. Every number is just what people want to make of it. No, numbers do tell us something incredibly valuable. But let's be very careful about what somebody is trying to do with that number.
That's a very good tip, that how numbers make you feel in terms of emotion. And I really like that phrase, the theater of numbers, or you're essentially using them almost like a dramatic performance.
Yeah.
And I see that all the time. Use a decimal point, or you use a really large number, or say something with millions and millions, where actually the order of magnitude is billions, so it means nothing. And I think you talk about it, the sort of the big numbers on the side of a bus in big letters and things like that. The public, the general public, seems increasingly interested in risk and data visualization and all of this. What do you think are maybe the basic life skills in terms of thinking about risk that we should be teaching people, maybe particularly teaching our children around maybe at the 10 years old or 12-year-old type of level? So apart from buying your book, Art of Statistics, which maybe is a little bit old for the younger children, I mean, the one I probably use the most is trying to transform risk into an absolute statistic and then use the baseline. So put it out of 100, for instance, 25 cancer patients out of 100 are alive after 6 months on a drug, against 20 cancer patients who received no drug. So you can sort of know the absolute measures versus one another. But what are the kind of skills or thoughts that you would emphasize for everyday risk thinking, and maybe one which children can try and get a grasp of now?
Yeah, that one you mentioned is easily by far, I think, the most important one to grasp. We wrote me and Jenny Gage wrote a book with Cambridge University Press called Teaching Probability, which is about teaching probability. And it's almost completely in terms of what you've described, which is expected frequencies. If we did this 4 times, if we did this 100 times, what would we expect to happen? The nice thing about that is that it's so easy to visualize. You can draw a little grid of people, you get kids to do this and things like that. So rather than think of words like chance or probability or whatever, or even percentages, it's been shown in experiment after experiment that if you do think in terms of expected frequencies, then that really enhances understanding. And so that is the absolute first lesson, I think, to everybody of every age. What does it mean for 1,000 people or 10,000 people? It's a bit tricky when you get to very tiny risks, because you kind of have to visualize 1 million people or something like that. Like the risks from, I don't know, side effect from the vaccines, about 1 in 100,000 or whatever. Well, you can draw 100,000 dots with one little dot, and actually I think it is quite useful to do. But that's quite tricky. And the other area where it gets interesting is things like climate change. Now, we haven't got 100,000 planets in which this is going to happen in some areas and some not. We're talking about, when we talk about probabilities of the future of the world, we're thinking about possible futures, all those different ways in which the future might work out, those little branches, those little tentacles that happen from our current state into the future. So multiverse idea. I love it. I love that in the book, Art of Statistics, so to really think about this as it's a real sort of metaphorical way to think about probability. It's not that we necessarily think this is happening, but it's extremely useful, I think, to think that the world may work out, we may work out in lots of different ways. In how many of those am I going to live another 10 years? And how many of those is the planet going to warm up by 2 degrees, et cetera, et cetera? I think it's an extremely useful metaphor, which I've tried to teach for kids in classrooms and things like that, just to think. I get a nice exercise to do with kids, which I've done. Okay, sit down, close your eyes. It's 4 o'clock and something. What are you going to be doing in an hour's time? Think about that. What are the possible things you might be doing there? Okay, what are you going to be doing in 24 hours time? Think about those. Which ones are more likely? Think about the possible scenarios. What are you going to be doing in a year's time? What are you going to do in 10 years time? What are you going to do in 50? And then, just to get this visualization of these potential futures, it's scenario planning, but you're also attaching some idea of likelihood to them. I think it's a really good mental exercise. that I find quite challenging to do for myself, but when I do try it, it's always very valuable indeed.
It's an interesting scenario planning, because that brings up two thoughts. So one, thinking about climate, one is this idea of the risks of not doing things, which maybe we'll come to, which I think is really interesting, because some of the climate is, well, if we don't do this, then this is something that's going to happen. And the other is what I guess people in science often fling around the words risk and also uncertainty. And then when you ask people about them, they define them sort of differently. Risk is often when you know the rules of a game, like you're playing backgammon and you've got dice and you kind of know what they would do. Whereas uncertainty is often where you don't quite know what the rules of the game are or what the distribution is. And so climate is quite a good one, is in we don't really know quite how to model the complexity of the Earth. We have an idea, and our models seem to do reasonably well over a reasonable type of things in certain cases, but there's a lot of uncertainty about that. So I guess I'm interested in asking you about how we should think about risk and uncertainty, and particularly uncertainty, because a lot of our world is that. And I think one technique you talked about that's very interesting, sort of scenario analysis and thinking about what might happen or what might not happen. But do you have any thoughts about how we should deal with uncertainty, and whether we should think more carefully about whether something is where you could apply risk and a probability and a frequency and feel fairly certain, or when it's something which is so uncertain, particularly with these smaller risks or uncertainties, which are very hard to get your head around?
Yeah, I mean, I spent ages trying to think about definitions of risk and uncertainty. I've given up, really. I don't bother. I try not to use the word risk anymore for anything, because people have got their own interpretation of it and immediately think, a bit like people, I talk about risk and say, oh, well, you come to talk to us about pensions. I don't know anything about bloody pensions. But some people, if you work in pensions, think that if you know about risk, you know about pensions. I know absolutely nothing about it, except for the fact I get a check every month. That's it. That's it. But the terms I quite like, because risks don't necessarily have to be quantified either. But I think broadly speaking, I like to think in terms of quantified risks, things you do feel happy putting numbers on. And then when you might be uncertain about the numbers, and then you've got deeper uncertainty when you're not even certain about, you can't even list the options, you can't even list the possibilities. You kind of don't feel there are things that could occur that you'd never even thought of. And that's the unknown unknowns, the Rumsfeld idea. So I prefer to think in terms of almost a gradual scale from fully quantified risks, like flipping a coin, but even of course that's assumption that the coin's balanced, right through to areas where you actually haven't got a clue what's going on. You're almost blindfolded in a dark room. You just don't know what's there. So there's what I regard as deeper uncertainties. So there's a continuum right across there. And I think it's unbelievably important to try to, well, it's possible to try to move things up towards the quantification stage, except to never believe you've done it. You've always got to have this possibility that something might occur you never even thought of. There's known as Cromwell's law. Do you know about Cromwell's law?
No, tell me.
Cromwell's law is that you should never, you should always imagine there's something you haven't thought of. And it's from Oliver Cromwell. He was ready to fight. Ready to essentially invade Scotland because the Church of Scotland was coming out against him, and he was trying to say, just don't. We don't need a battle. We don't need to fight. Just don't. And he wrote a letter to the Church of Scotland saying, "I beseech thee, in the bowels of Christ, think it possible you may be mistaken."
Very good.
Just have that little epsilon humility and doubt that you actually might be completely wrong and something else might be right. Just always retain that. Anyway, they didn't admit it because the Church of Scotland was notoriously stubborn, and of course he thrashed them. Anyway, so that's that Cromwell's law. Always remember Cromwell's law. What's fascinating at the moment is what's going on with this Omicron variant, and because we are exactly faced with that situation at the moment in the UK. Because there are all sorts of possible scenarios. Modelers put out different scenarios. They've been criticized because they haven't put probabilities on those scenarios. In other words, they haven't sort of explored the whole range of possibilities. The more optimistic ones they haven't been doing. And so this has led to a lot of criticism, and I think some doubts from the cabinet when they're making decisions about what should be done. And so this, very interestingly, this discussion about envisaging futures. Can we list the possibilities? Can we put probabilities on this? It is absolutely at the root of government policy at the moment, affecting all our lives. It's riveting to watch it. And of course, we will find out a bit more later. And also, as you said, the range of options being considered, the models being considered do include not exactly do nothing, but just stick with what we're doing at the moment, no extra measures. And that is in there as an option. But even within those policy decisions you might make, you then have to consider, well, in terms of the things you're not in control of, to explore that, I feel strongly you should explore the whole range of potential plausible outcomes with some idea. It's very difficult to put a probability on them all, but some idea of what that range might be. So it's a very delicate matter. But then, of course, you're left at the point in decision making where if you can't put numbers on everything, and which you never can, what's the appropriate strategy when you've got a lot of uncertainty and the possibility of really bad things happening? Do you take a precautionary principle? And a lot of government strategy is based on looking at worst case scenario, really reasonable worst case scenarios. It's official. That's what you're supposed to do in order to plan for the best and worst and hope for the best. So in other words, the planning is based on pessimistic assumptions. Now that's that sort of makes sense. That's sort of weak precautionary principle that, and until things are proven to be, you don't have to prove something's dangerous before you take precautions against it. But just how pessimistic? Where should that point be? What are you planning for? Are you planning for not the expectation, but you're planning for, I've talked about this for ages, something that's sort of 99.5% pessimistic or 70% pessimistic, where in this distribution of possibilities, which you can, if you could imagine it, well, what are you planning for? So I think I really wish this was, this sort of reasoning has suddenly become public and become really controversial, that they are planning for pessimistic situations. That's what the modelers are doing. And that looks like it's actually being slightly rejected by the government for various reasons. Riveting to watch this going on. Risk management in practice. It's really red in tooth and claw. Yeah.
It's really interesting because typically when I hear experts talk about, well, we're even more uncertain, then they tend to go more cautiously because they say, well, our point estimate or our number here, we're not sure, so let's wait and see. But in this scenario, because you may have exponential numbers, or that the waiting, this doing nothing, is also potentially costing you something. Yeah. Whereas you think precautionary principle, the planet's quite a good example, because there is no planet B, which people would say, and because you can be reasonably certain that human actions are causing this warming, of which there is a decent chance that something really bad would happen. You should probably do something. You should probably do something about it. But actually, in the case of the pandemic, there's so many of these other complicated trade-offs that it's not as clear. And also, your Cromwell's law has reminded me that seems quite close to or adjacent to what I think Nassim Taleb has suggested with these kind of black swan ideas. There's always something that you need to be aware of that is not in your universe of calculations. And actually, I think he often talks about these so-called, I think the sort of everyday parlance for it is like these fat tails, which are these small chances of extreme events, but seem to happen a lot more than you thought. And he also suggests that I think a lot of models that we use don't work that well in the real world because a lot of these things, and that's just a suggestion that there's a lot higher uncertainty. And I think it's what you said, is that you have to be potentially a little bit more humble in the face of that. But with something where you have to do pandemic planning, where no decision actually is a decision, it just seems to be a very complicated trade-off to think about.
Yeah. I mean, I think the fat tail business, I mean, that's standard in statistics of power tails. I was appalled when I looked at the apparent naivety of some of the financial models and this stuff, because if you're working in extreme value theory, you're used to very fat tails indeed. In other words, you're modeling events the size of which you've never seen before. And that's what you should be doing in an extreme, because that's the whole point. They're extreme values, and that's all developed mathematically. And anybody working in a catastrophe would be very familiar with all those ideas. So it's not like it's some massive innovation, I don't think, but it is overlooked by some people, I think, and that's really unfortunate. I think so. There's the modeling point of view, and you can really have a go at that by having very, very, very big tails to your distribution. From the risk management point of view, I think again, there's been I can't remember lots of people have written about this stuff, but I really like this idea of the difference between robustness and resilience. And a robust strategy is one that should work under a wide range of envisaged scenarios. You've thought of a lot of things, and you made sure that what you're doing, it should hold up among these things that have happened. But a resilient strategy is one that should hold up even if things have happened that you never thought of. The idea is that you can't list all the stuff that's going to hit you. And so and that means it's expensive or resilient. You have to in other words, like supply chains, you have to, even if you haven't thought of exactly why something might be disrupted in a certain way, you make sure you've got resilience in your supply chain that could stand up to almost any wide, obviously, if an asteroid destroys the Earth, that's not going to be much good. But never mind, for things that are potentially that you might be able to deal with, that you should be resilient to a wide range of things, including those you haven't thought of. And I quite like that idea of which I think people can grasp, that you can make a list, but there's always you can always guarantee whatever happens won't be on the list.
Yeah. There must be another law for that. Yeah.
And that happened with this pandemic. The risk planning for the country. There's a very good national risk register. I've worked on some of that, some of the volcanic stuff, which no one, it seems to, it's never publicized. No one's, it's never scrutinized. The media don't cover it. And the flu pandemic has always been in the top right-hand corner of the risk matrix as being the most likely and the most harmful thing. We didn't have a flu pandemic. The emerging virus, pandemic was way down and not considered a huge threat. So that and the crucial thing is that the uncertainty about that emerging virus was not fully taken into account. It was plonked in the middle of the matrix as not being, it might cost a few hundred lives, might be this and the other. In other words, they were planning. It seems to have been around one scenario. What? So I think, again, it's this restrictions in terms of the imagination about the potential possible futures that is one of the big issues there.
So there's a group of thinkers or people often associated with effective altruism or long-termist, and they talk a lot about existential risk. So these are these small risks which could kind of do really badly for humans. So climate, I guess, nuclear, lab-made pandemic, and things like that. So everyone can agree that the risks are quite small. No one can really agree what the numbers are. And there's probably these categories that you talked about the risks that we probably can't even envisage, which might impact us. Do you think we should maybe be spending less time thinking about these things because we can't do that much about them? Or should we maybe spending more time thinking about them to try and develop technology to handle it? Or maybe, I guess, for some, when you're looking at nuclear war, having so many safeguards that we don't really go anywhere near that type of thing. Is existential risk a category that you've come across and thought about much?
Yeah, I think I was on the advisory board for the Cambridge Centre for Existential Risk at one point, but I left that. I think they're doing great stuff. Somebody should be doing this. I'm really glad this Cambridge Centre exists. They're very good people. Somebody really should be looking at this stuff. What you do about it is a different matter. For example, the gain of function. I remember years ago being, having talks and people really saying about the danger of gain of function experiments. Now, I'm not saying where this virus came from, but it is plausible that it escaped from the lab in China. I'm not saying it did or it didn't or anything like that. I don't know.
Plausible scenario.
Don't know, but it is a plausible scenario. And so what that suggests,
and it's certainly a plausible future scenario from any lab somewhere. Exactly.
So I remember reading people's concern about gain of function research and saying, "Oh, come on, well, poof, we're all right, we can control this." Anyway, so I think my alert levels there were completely wrong. I was wrong. And so I'm glad I'm not in charge of any of this stuff.
Yeah.
Now, but it's too easy as well at the same time to make a big fuss about stuff that actually, you can always, something's can always happen. We can always imagine all sorts of horrible things might happen. So it's assessing the level of plausibility, I think, which is a matter of judgment, because by definition, you're talking about things that have never happened. And so statistical models can only go so far. So I think somebody should be looking at this, but they need to be, in a way, it needs to be a lot of, need to be very cautious, I think, about what you build up as being a real risk or not. I think a lot of the claims about AI are a bit overblown, to be honest.
Sure, that makes a lot of sense. I mean, it does circle back to what we've been discussing a little bit sometimes about this risk of not doing anything, because you can choose so many things to do. You've got resources on not everything. I think about this a little bit in terms of regulatory. In fact, we're facing this situation now. There's an antiviral drug which is sitting at the regulators. I think the US regulator is looking at that. And if you ask most observers, they are 99% sure that this drug is going to pass through. And then some people who are running sort of some of the stats from it saying, well, assuming this is true and there's infinite supply, which there isn't, but every day you delay, you're costing statistical lives from that delay. So this is the risk of not doing something is costing you. And they sort of make the further point that actually the regulators don't get that much reputation or incentive by quick approvals, because those lives which are dying from not having the drug are not easily countable within that. It's a classic kind of regulatory or split incentive problem. Do you think we should be paying more attention to these risks of not doing something, or is it just a little bit too complicated with what the resources that we have when we're focused on them and where we have them?
Well, again, this is risk management, a topic which I'm desperate to steer away from, but everyone always asks about it. So I suppose I've got to talk about it a bit. Yeah, no, it's very important. When it comes to regulation, this is very important, because the inertia of regulation, can be a real dead hand on innovation, which can be costly. I mean, we've been through this before. Went through this with AIDS in the 1980s, in the early 1990s, and the accusation the FDA was far too slow in approving AIDS treatments, and there's a big activism, public, real serious activism, but also some absolute commitment of the AIDS community to engage also with that process, and they changed the whole way in which the way in which drugs were approved, about experimental release and so on. So they had a big impact because they felt it was so important not to have such a huge built-in inertia in the system. We've seen with the vaccines, just how fast things can be done in terms of approvals, far quicker than would normally be done. So I think one of the what all that has shown is that when there is genuine public interest and concern, things can change. The bureaucracies and inertia can alter. At the same time, it's absolutely vital that you have these things. When you think of the absolute crap that's been suggested as being wonderful drugs for COVID, God, and I don't know whether it's hydroxychloroquine or ivermectin, all this sort of stuff. You really, someone's got to look at this stuff quite seriously, both in terms of the safety thing and also whether you're going to pay for it or not.
Sure. No, that makes a lot of sense. So there is a dead hand, but there is definitely a trade-off, and I guess that's something for our politicians or our social scientists to look at.
Yeah, but that's why I want to come back. It's not shouldn't just be left up to them. I mean, this is something where I think public interest and and pressure, if necessary, from certain groups. Well, there'll be pressure from all sorts of groups, but I think that this is should be a matter for public discourse. It should not be just a matter for experts and government and bureaucrats.
Because we all have an
it's quite reasonable for regulation to be a matter of public discourse. That means it will be more contested because there will be sides and different arguments. Well, that's the way it is.
Yeah. Well, and your analogy with HIV then is actually quite a good one there. So there's a couple of medical statistics I've picked up, which I'd be interested in your opinion of. So one is on alcohol. So the World Health Organization writes that alcohol consumption contributes to 3 million deaths globally. And they also write that harmful use is responsible for 5% of the global burden of disease. But they're quite careful, I'm sort of reading their press release, to use the word contribute, because in the footnotes and all of that, they go, well, it has complex associations with conditions like cancer, to probably make things like cancer worse, but they might have some cardioprotective, and it depends on excessive use. And then when I've looked at some plots of actual data of small data sets on population, so again, a lot of this is kind of modeled and doesn't use actual data, but when I look at some actual data, it seems to me that there is a smaller percentage, maybe 5 in 100 up to maybe 25 in 100 of people who have this much higher alcohol use, and is this population which seems to be contributing to a lot of the negative statistics that we see, for instance, on hospital admission and things like that relating to alcohol and that. But that means the vast majority, sort of the other side, you know, anywhere between 75 to maybe 95 out of 100 of people are really seeing limited to no sort of effects from their alcohol use at all. And I've been flip-flopping around that, and you get papers who are written by one type of funder, they're in another, and seem to be quite biased use of these emotional numbers. And then there's the difference between the personal risk versus the statistical life risk, which you've mentioned. So I would be interested to think about how you think we should think about alcohol statistics and risk overall.
Oh, I've got waves of nostalgia because before this, damn virus thing came along, I spent a lot of time arguing about, the effects of low dose alcohol and criticizing so much of the studies and the communication that was done around it, because it really annoyed me. And oh well, let's get back to it. What fun! Okay, so the first thing is the population level stuff that WHO saying about contributing, and you've got to be careful with your words, because, for example, if you look at air pollution, for example, actually I think one person in the UK has had air pollution on their death certificate. It's that nobody has it on their death certificate, and yet the suggestion is that it in a sense leads to, or tens of thousands of excess deaths every year.
Actually, that was my second question, so it's rolled in. So I'll give you the stats. The WHO claim outdoor air pollution is attributed to 3 million deaths, and they use the word contribution again. 9%, almost 1 in 10 deaths, which seems an extraordinarily high number, but must be due to the stats.
So that's all based. It's all based on modelling. So what happens is that a decision is made from epidemiological stuff that 2% or something of asthma deaths are due to air pollution or something like that, and then you look at asthma deaths, and 2% of them count towards that count. So there's a lot of it's all based on modelling, not actually counting. And of course, it's mainly the same with alcohol as well. You get a certain number, not that many, of alcohol caused death. It's actually on the cause of death in the death certificate. But alcohol does raise the risk, I think, of breast cancer and other things. So, so it does contribute to a lot of ill health. Now, the crucial thing, I suppose, is it's not, first of all, is the curve at the J-shaped? In other words, is there a benefit for low dose in terms of all-cause mortality or cardiovascular thing? And the other aspect, I mean, people can argue till the cows come home on that, and actually it's unbelievably difficult to tell, because you're trying to make the difference. What's the difference between people who drink a little, essentially, versus people who don't drink anything? But the real problem is that people who don't drink anything have got really bad health. Yeah. They've got the same, they're really unhealthy people on the whole, people who don't drink. If you look just at the risk of teetotalers, they've got the risk of comparable with fairly heavy drinkers. Because there's a reason people don't drink, partly because, I mean, even if you get rid of the ex-drunks and get rid of those, the people who never drunk, often because actually, for various reasons, I mean, one possibility is that because of their constitution, they just don't like alcohol, they can't take it. So they're actually not very robust people. So it's all sorts of reasons, but for whatever reason, non-drinkers have high mortality, no doubt about that at all. Which I think is interesting, which nobody ever seems interested in that. So you're trying to distinguish, really, because if you can't use non-drinkers, you're trying to distinguish the difference between the effect of people who drink almost nothing to people who drink very little. You can't do it. You can't do it. It's hopeless, absolutely hopeless. So we don't know. Whatever it is, small amounts of alcohol do not have a big difference effect either way, really. And, people enjoy drinking, well, that's fine. So I think there's been far too much attention bickering about this. And what's important is that, the curve then starts going up pretty steep. Once you start slugging it down, the curve goes up quite steeply as to harms. And that's what causes the harms. The harm at the individual level. The problem is you've got this, do you know the Rose paradox after Jeffrey Rose?
No,
Very powerful idea. Oh, it's about the fact that, if you want to make a big difference to public health, and because people drink too much or don't exercise enough or overweight or eat too much fat, whatever, then the normal way you'd think of doing, let's find the real high people and try to get them down. But actually, if you want to maximize the overall benefit, what you should do is move the whole curve to the left. Even the people who are moderate or even low, just get them all, in other words, get everyone to reduce their amount of consumption by a certain percentage. Everyone moves. And that has the biggest impact in terms of overall public health. But in terms of individual health, it means you're aiming a health message at people who really, they're unlikely to be harmed anyway, and they won't notice any effect of their change of behavior. All these low risk people, you're putting them into a slightly lower risk category. But because there's so many of them, that move can actually produce a bigger public health impact. But at the individual level, it's completely negligible. So you have this point that, government messages about, drinking less and things like that can be rational at the population level, and yet it's also rational for individuals to take no notice of it.
Okay, so that
unless they're heavy drinkers.
Yeah,
So
okay, I hadn't heard that articulation before, but it makes a lot of sense, and that's
it's
why you have
quite
the
tricky.
the same one, the cholesterol on the statins.
Yeah,
that same idea.
Move
the curve, whereas
everybody comes down. I mean, that's why some people say everyone should. In fact, everyone over 60 or something should just take statins. I take statins. You just move you down. Most people won't notice. I pop my statin every morning. I have absolutely no idea, and I never will, whether it's done me any good whatsoever. But it has lowered my cholesterol, and so I estimated my risk of a heart attack or stroke about halved over the next 10 years, but I've got no idea whether it actually happens or not. Absolutely not. But it's at the population level, it's very effective.
Rose paradox, very good. So so those air pollution stats do you think they're fair, or they're fair from the model, but you think they're a little bit misleading? I mean, I guess the flip side, while you think about it, although I think you've got an answer already there, is because when I think about, and I was looking at these so-called bills of mortality, which were written in the 16 and 1700s on them.
Lovely.
And what came through was that there were some things on there which seemed to me like true causes, but which never get put on your death certificate. So one of the classic ones is grief. I know a lot of people who essentially probably have died of grief, but obviously at the end it was a heart attack or whatever it was. Or going back to our very first question, that a lot of people underlyingly really they died of deprivation, they died of poverty, but it was something else which is the causal part. And air pollution seems to go maybe the other way, although again it's not on the death certificate. So some things that we really die of, that real underlying cause, never gets recorded, and then some things are the other way. But I guess that's two questions. One is, are those air pollution stats fair? And second is, do we sometimes really miss that underlying cause, like something like grief, because that's hardly ever going to be put on your death certificate?
Yeah, I mean, there's loads of things that poverty does not get put on a death certificate, and yet we know at a population level or even an individual level that raising people out of poverty improves their health. So and that's a sort of standard thing, and air pollution is one of them, all sorts of things, because death certificates to do with immediate causes. It's all to do with immediate causes. It's where, the doctor has to sign, what is the cause of this death? There's a bit of a chain there, but you have to have an underlying cause. And often smoking won't go in there on the death certificate. So those, in a way, underlying deeper causes have to be inferred at the level of populations using epidemiological methods. But it makes it no less real, I think, in terms of what's going on. It just means you can't count it. You can't count them, which is a rule, for a statistician, that's rather frustrating. In the end, you have to model these things, which makes them a bit more easy to contest, to be honest.
So do you think
the bodies?
The order of magnitude of air pollution, is that roughly right, do you think then?
Well, I was thinking, what does that mean? Does that mean that I think it is. Yeah, they don't look implausible, the figures. That, in other words, if you suddenly took all the air pollution, we all live in wonderful, clean air, then you'd have fewer deaths happening each year. I don't think that's implausible because of the accentuation of other underlying conditions that you might have. But that, of course, is, you can't test it experimentally, particularly. It's all based on models. It's never testable, essentially, except the only way it's testable in a way is when suddenly you get a great big batch of air pollution, like we used to get with smogs in London, and we still do in places like Delhi when they're burning the crops outside, and suddenly people are really sick.
Deaths.
Yeah.
So I mean, but that would suggest that maybe governments, although I guess they are, should potentially be doing a little bit more about something like air pollution, even though they'll never be able to quantify as easily. Well, these are the actual number of lives saved. It's one of those unquantifiable but big areas that we could potentially improve.
Yeah, and I mean, a lot of people are putting pressures on for things like that quite reasonably. But very often, as you said, all these things go together within a cycle of deprivation and poverty and say rather more nebulous things. You mentioned grief, but also lack of ambition, of a feeling of well, I suppose deprivation, but in a broader sense than just not having much disposable income. It's a much bigger idea than that. Now, those are very nebulous ideas, but actually we all know, we could look at it statistically, but actually we know personally, we feel how important those issues are. That their feelings about their environment and their feelings of their potential, in fact, that the well-being in their life is enormously important, let alone for their mental health, of course, but also for their physical health. So I think that is pretty appreciated now. Now, what you do about it, of course, is a different matter.
Yeah. Okay, one more on the stats. I'm interested in your thinking on essentially expected value, and particularly on the concept of transforming the value of a statistical life potentially into a dollar value. We have this in healthcare quite a lot, where you think about daily adjusted life years, or the cost of a sort of a quality adjusted life year. The nickname is QALY. How useful a statistical concept is it in terms of valuing life, and should we be doing more of it or less of it, and how do we best use this technique? Because a lot of people kind of think like, oh wow, like statistical life is going to be valued at whatever it is, £1 million or 50,000. But I was talking to a public policy philosopher the other day, Joe Wolfe, who made the point that if you don't do these type of calculations, then by default you're accepting something, but not knowing the inputs or choices that you're using. So I'm just interested in whether you think expected value is and that sort of concept, and how much value kind of it has in the statistical thinking.
Yeah, I'm glad you talked to Jonathan Wolfe. He's excellent. The stuff he did on rail, I use as a constant source, rail safety, and the idea of shame and things like that was so important to me. I've learned so much from what I would call jobbing philosophers, like Jonathan Wolfe, who roll their sleeves up and say, well, okay, how am I going to use my philosophy in this practical problem? And the other one is Honora O'Neill, the philosopher of Kant, who has had a huge impact on the statistics of communication, the statistical communication thing. Anyway, that's by the way. It's just expressing my enormous respect for roll your sleeves up philosophers. I love them. Okay, back now, where was I? Oh yeah, putting a value on a human life. Oh, I think it's a brilliant idea. Provided that you treat it appropriately. So it's done in two main areas: in transport value, value of a statistical life, VOSL. It used to be about 1.6 million in the Department of Transport. It's probably gone up a bit more now, but that's used broadly to decide about road improvements and things like that. And in health, it's used all the time by organisations like NICE, who value a quality adjusted life years between 20 and 30,000 pounds. Sounds like it should go up a bit recently. It's been stuck at that for some time, and is used as a broad benchmark to decide about which treatments are going to be paid for within the National Health Service. And which when they started doing that, caused a lot of fuss. Oh, you can't put a value on a human life. Of course, you've got to do that. I mean, how else are you going to decide? Otherwise, it's just left up to the loudest voice to say, oh, we need our treatment for this. We need the NHS to pay for this. We need this. Everyone would love that, of course. But actually, if you give, with an organization with a limited budget, you spend money on one thing, you're depriving somebody else of something else. So while it's not perfect in any sense at all, having that basic acknowledging that that's an appropriate framework is, I think, a very good step indeed. And I was involved in, for example, doing that kind of stuff for, oh God, what were they, vaccines for something or other? Vaccine cost effectiveness. I did. Now, there's all sorts of let outs for it, and it gets misspec, but like, you pay more for cancer treatments now, you pay more for end-of-life care, because you're not going to, because if someone's not going to live very long, you're not going to get that benefit from it. Clearly, within panics and pandemics, that all went out the window. I mean, what's the cost effectiveness of all these lateral flow tests we're taking and things that all these freebies we're getting and we're throwing away? Who knows? All that cost effectiveness goes out the window in a crisis, essentially. But when you're in a more stable situation, when you can kind of do the numbers, then I think it's an incredibly valuable exercise to do. Well, admitting it, it's only a guideline. It's not third decimal place stuff.
So a lot of behavioral economic theories at the moment have this idea of rational expectations. And then they point out that people don't behave like these models a lot of the time. But there's a kind of, I guess, a counter-prevailing backlash to that, suggesting that maybe the models are wrong rather than the people being wrong. Like this idea of rationality is only something which is coming out of a model. So I'm interested in what you think about rational expectations and whether it's helpful or not. I guess because this plays into nudging. It also maybe plays into behavioral change for health and these things, because they're kind of using at this core rational expectation. So I'd be interested in how you view that.
I think you could, it's very important. And there's a lot of Steven Pinker's book on rationality is very important. I think you've got to distinguish us as individuals and our behavior and policy level stuff at a societal level. And I don't think there's, if we've already talked about the fact that if there's a lot of unknowns, deeper unknowns, then it may be more reasonable to take a precautionary approach to guard against the worst. If there aren't, if you really know what's going on, like you feel you can establish the parameters, the structure of your decision, then expected gain must be the right thing to do, because you're maximizing the return for your investment in NICE. You're going to spend so much on health service. You want to get, this is pure utilitarian ethic. Now, of course, there are, I don't know any philosophy. I wish I did, but that is a very utilitarian approach. There's also a role for much more duty ethic, Kantian approach that in some circumstances, for example, a named individual who is suffering, suddenly you'll spend a lot more on them because you have a duty to protect, the vulnerable lives for those individual people. So there's always, it's not a simple thing, but basically that seems extremely reasonable at that big level, essentially when everything averages out and the structure. It's like insurance. That's how that works. Now, at an individual level, there's absolutely no reason why we should be rational for a number of reasons. First of all, that we don't know the values and the probabilities. So how could we exercise maximizing expected utility? Secondly, the whole idea of expectation really has got some idea of there being the opportunity to repeat or to average over a context. Whereas if you only got one life or one planet, then maybe you do want to just protect against the worst. Maybe you do want to be cautious, or maybe you want to have adventures and take risks and things like that. That expectation, although you could think that you make repeated decisions through all your life and you want to maximize your expected enjoyment over your whole life, I think that I wouldn't expect anyone to act in that way particularly, but largely because we just don't know. We don't know how we'll feel about things at the time and so on. And I think that this, at the same time, in certain circumstances, we should stop. We should try to be rational. And this is the thinking fast and slow idea of Danny Kahneman, which is very powerful indeed. So I disagree with the idea that somehow this is a fault in us, the fact that we're not, entirely rational people. I actually think this is not a fault. This is part of being human, that we operate with our guts, with our emotions. We respond in ways that are not formulaic, partly because it'd be impossible to do anyway. At the same time, in certain circumstances, we shouldn't operate with our guts. We should be questioning what to do. And in particular, when anyone's trying to manipulate us, we should be sitting back and trying to take the arguments apart and weigh things up. And secondly, when we have got difficult, important decisions, financial decisions or health decisions or risk-taking decisions, and we really should be trying to think about what the possibilities are, how likely they are, how bad it would be if certain things happen, and operate accordingly. Maybe not still for expectation, but at least to protect ourselves from the maximum losses.
Great. Okay, well, coming up to the last couple of questions, but that's really interesting. I think the way you articulate the difference between a sort of population level and an individual level, but even so at an individual level at certain decision points, taking a step back and thinking and trying to engage a different part of the brain might be worth it. I do sometimes think about the unintended consequences about some of this population level or what you do. The silly example I have is I read some statistics, so it might well be false, probably done by an egg person, right? But there's something like 720 million eggs thrown away each year in the UK, and about 3 in 10 Brits are doing this solely on a best before date because they're worried about bad eggs, right? But actually, it's quite hard to get the data, but I looked into it, and death from food poisoning by eggs, so this would be salmonella, is extremely rare in the UK and Europe due to regulation. In fact, last year and most of the years in the last 5, we haven't had any at all. So you can get hospitalized, but there's no deaths recorded in the UK. It's a little worse in the US. I think there are about 30 deaths in a year. But the sort of flip side, particularly if you were worried about the planet and say take the UK, is 720 million eggs, or the 30% just from the best before, where the eggs are probably not off yet, is a sort of enormous amount of other cost in a different part of the system. And when you're looking at the food agency, they're never really going to take into account the food waste part of their mandate, because they're always, probably quite rightly, going to be worried about the food safety bit. And then this goes into your absolute risk. I mean, the other one I think about is different countries' advice for pregnant women. I find it's really funny, because in Japan, they never advise against raw fish. And in France, they don't advise against blue cheese, because they know that there's kind of no point doing that, because people are going to eat it anyway. And the absolute risk is very, very low, even though the relative risk might be higher. But I don't think that's a conundrum that we can necessarily get. But I do think some of those unintended consequences of the system as a whole, it'd be really nice if someone in government or policy was trying to put that together and think about it and say, well, actually, maybe we should tweak the mandate or the advice here. Is this something you come across often?
Yeah, well, again, I try to avoid it because, as you said, it's to do with regulatory incentives and precautionary principle and where you draw thresholds. And I mean, for me, the biggest misunderstanding is people thinking of there being a single threshold. Suddenly something goes from being safe to unsafe, which is complete nonsense.
Spectrum.
And so, so people could set a threat like they do on the best before date. Everything should have 2 dates, which would be, okay to, the first date is ideally, eaten before this date. And the second date is don't eat after this date. And in between, there's a range. And this is known as the tolerability of risk framework, which is absolutely entrenched in the legislation for the Health and Safety Executive in the UK. It's been fantastically successful in the UK. And essentially, health and safety philosophy in the UK is not based on a single risk threshold. It's always 2. And so you've got a level below which something is considered safe, a level above which things are considered unsafe. And in between, there's this grey area where you should be trying to reduce the risk, as low as reasonably practicable. But there are trade-offs, and things might, maybe you can't do it now, but you should try, but it's not the end of the world if you don't, and so on. And I think the biggest, and same with alcohol and all this stuff, trying to produce a single threshold is such nonsense, because you're drawing a line in the sand, and one group, the group setting the threshold, has got an incentive to make it to be very cautious, and then the consumer, as you said, throwing away the eggs, thinks, oh, anything above that is dangerous. No, they never said. Nobody ever said that. They didn't ever say that. They said they know it's safe. If it's above that, and so you got a conflict of incentives there, with people taking an act without thinking of the full consequences. And I think it's crucially to do with the naivety about trying to set a threshold on something that hasn't got a threshold.
Yeah, I hadn't heard of tolerability of risk, and I didn't know
it's
that
really
about
powerful. The TOR, it is such a powerful. I gotta just bang on about it all the time. You need 2 thresholds for everything.
Well, because I was speaking to a climate scientist the other day, and that was one of the points he made, is that for communication, a lot of people using 1.5 or 2 or 2.5, but actually that point estimate is not at all really what the models are saying. It's this spectrum, and it's not a threshold.
Yeah.
So last 2 questions. One is, what do you like about stained glass art? And what maybe should we know about stained glass? Because I believe that you did some.
I do.
Glass art.
Yeah, I do. I've got some in the shed at the moment. I've got to finish off for Christmas. So yeah, I do stained glass stuff. I like doing it because I haven't got any artistic skill whatsoever, but I can copy sort of mathematical patterns, and I love the impression of stained glass. I love churches. I spend my time going around churches and cathedrals with my binoculars, because first rule thing, always take binoculars into a church, because some of the best stuff is hidden away at the top. Some of the best windows in York Minster, you can hardly see from the ground unless you've got very good binoculars. It's way up, and it's brilliant stuff. And
I didn't know that. Is it the detail of the patterning and the shapes, or is it how the light goes through, or all of it?
The light as well, but basically it's the detail of a lot of the old. I love old glass, but what I really like about it, partly it's quite a forgiving technology. I'm not very skilled, and provided if you look at it with the light behind it, you don't see the poor quality leading and the poor quality soldering, so that's really good. Although I always look at it very carefully now. But what I really like about it is both the fact that one can produce things that are quite nice without huge amounts of skill, but that the technology is basically unchanged since 1200s. 1204, so the stained glass in Chartres Cathedral, which is just the most wonderful thing. Everyone should go there, not just to see the labyrinth, but see the glass at Chartres. It's staggering. So that's why I love it. But you don't, using lead, using colored glass. Okay, I have got a diamond, tipped glass cutter now, and they didn't have. But for example, and then you're using the solder, which is exactly the same. And what's nice, the flux I use when you're soldering the lead is a tallow candle. There's a tallow, you buy them from the shop, and it's a tallow candle without a wick. Yeah, and that's what you use to do it. Well, that's what they were using in 1200.
That's amazing.
Isn't that lovely? The technology. I also got a grinder for finishing off my stuff. So there's 2 cheats, but apart from that, actually, I've got a really nice lead cutter as well.
3 cheats maybe, but
3
same
cheats.
same principles.
And I got a temperature controlled soldering iron. So there are a few cheats, but the basic materials are not changed since 1200.
Actually, that reminds me. I think I was reading again something that Nassim Taleb said, although I don't think it was his concept. This idea of something being Lindy, which I think referred to a restaurant or a bar in New York, but this which was a restaurant which the longer it survives, the kind of more likely it is to survive type of concept. So this is the idea, the stained glass, it survives so long that there's something valuable to it, and actually surviving in this form means that the longer it goes on, the more likely it is to continue to survive.
It's resilient.
It's resilient. Exactly. Yeah. Great. So my last question is, I guess, asking for your life advice in general, what you would advise people to think about in terms of life advice, maybe. And we touched about this, you can think about this in risk, and maybe obviously there's Omicron at the moment, but what would you generally advise people in thinking about life or risk, or or
Oh
any
yeah,
advice that
okay.
you'd like to.
Yeah, I mean, I'm hoped. Nobody should ask me this stuff, but I do. I can. All I can do is say what I used to when I used to give a lot of schools talks and talk to kids about risk and things like that. And what I always said was, yeah, take risks, be bold, take risks, but don't be reckless. Don't be reckless. So in other words, think through the possibilities and make sure you really strongly mitigate the worst possible outcomes. So, but go for it, because the upside of taking risks is the experience, the lesson, even if it goes wrong, and the joy of, and the excitement of, and the fun.
Yeah.
So I put a huge, huge value, both monetary and personal, on fun, which doesn't tend to get into the equations very much at all. But that's why I do idiotic things like going on winter wipeout, and I like cold water swimming, and I like jump off cliffs and things like that. So I love all that kind of stuff. But I'm always careful. If I'm going to jump off a cliff, I make sure someone's jumped off just before.
Yes. Okay, that makes a lot of sense, and that's the kind of idea that a life too cautious is not a life well lived. So you've got to take risks,
exactly.
but mitigate them obviously in sensible things, but don't be put off.
Yeah, that's my philosophy, and so I hope nobody ends up getting injured because of that philosophy. So I say no, be careful. Be careful. Yeah.
But take that. Well, great. Well, on that note, I thank you very much, and also for everyone listening, do look out for the books that David's written. So thank you very much.
Thanks. It's great conversation. Thank you. Okay, great.
Bye.
Bye.
If you appreciate the show, please like and subscribe, as it helps others find the podcast.